are public hospitals across Europe on life support. Hospitals are facing staff shortages, lower wages, and increasing levels of overtime, prompting industrial action across the healthcare sector since the beginning of the year, which inevitably impacts patient care. In Sweden, healthcare workers went on strike for the first time in 16 years. In the end, they managed to obtain reduced working hours for those who work night shifts and a 3% salary increase.
Last year, 2023, they did 3 million overtimes hours. So we knew that there were a lack of nurses, midwives, radiographs, and X-ray nurses.
In Germany, thousands of doctors at state-owned university hospitals staged a strike after collective bargaining talks with hospital managers failed. Their trade union demanded a 12% pay rise and higher bonuses for working nights, weekends, and public holidays. In Slovenia, doctors and dentists working in the public healthcare service went on strike in what has become the country's longest ever doctor strike. They withdrew consent for overtime work in a bid to pressure the government into honoring its commitments to a previously tabled health reform. In France, a measure of a different kind has sparked outrage among medical students. There will be 1,500 fewer openings for junior doctors this autumn.
Travailler à l'hôpital, il est très très difficile. Il est très demandeur sur le plan mental, sur le plan physique, aux internes. Et là, on sera moins nombreux pour la rentrée. Sauf que la charge de travail, elle ne diminue pas.
Tous les ans, il y a une adaptation des postes par rapport au nombre d'internes qui se présentent. Sauf que là, il y a eu beaucoup plus de redoublement.
Europe has more doctors and nurses than ever. However, their demand is growing at a faster pace.
There is an increase of demand basically because of four main factors: the aging of the population, the increase of multimorbidity and chronic conditions, also because of the backlogs accumulated during the COVID pandemic in terms of waiting list, and also because of the increased expectations of patients that is creating also an increase in the demand for services.
The World Health Organization Europe has warned of a ticking time bomb threatening health systems in Europe and Central Asia. In some countries, more than 80% of nurses reported some forms of psychological distress caused by the COVID-19 pandemic. As many as 9 out of 10 nurses were thinking of quitting their job. In response to these challenges, representatives of World Health Organization Europe adopted the Bucharest Declaration in 2023. It calls for political action to improve the recruitment and retention of healthcare workers and increase public investment in education.